Cardiogenic shock, causes and prevention. Cardiogenic shock occurs when the heart cannot pump blood to the brain and other key organs. It is a medical emergency that requires immediate treatment. Cardiogenic shock can result from a heart attack or other issues of the heart. Quick treatment is necessary to avoid complications or death. Taking steps to boost heart health may help reduce the risk of cardiogenic shock. Keep watching to learn more about cardiogenic shock, including the causes, symptoms, treatment options, and prevention. What is it? Cardiogenic shock is a state that occurs suddenly when the heart cannot supply fresh blood and therefore oxygen to the brain and other organs. Without blood and fresh oxygen reaching the organs and brain, the body goes into a state of shock. Cardiogenic shock is a medical emergency. Without immediate treatment, cardiogenic shock can be fatal. Even with proper treatment, cardiogenic shock is still potentially fatal. Research in open heart notes that 25 to 50% of people who present with cardiogenic shock will die. Part of the reason for this high mortality rate is that the shock state can act as a cycle of sorts. The initial damage leading to the shock causes the body to go into this state, which may then trigger more damage and further shock. Swift treatment is necessary to avoid this cycle and help give the person the best chance of recovery. Causes. The National Heart, Lung and Blood Institute state that a heart attack is the most common cause of cardiogenic shock, but not the only cause. They note that other possible causes include heart failure, chest injuries, certain medications such as calcium channel blockers, although this is rare. Blood clots, fluid buildup in the chest, internal bleeding, blood loss, pulmonary embolism, rare complications from procedures in the heart. Some people may have an increased risk of cardiogenic shock, including those who are aged 75 years or over, have underlying cardiovascular disease such as atherosclerosis, heart failure, or ischemic valve disease, have overweight or obesity, have diabetes or prediabetes, have lung disorders such as pneumothorax. Cardiogenic shock is more common in males than in females. Furthermore, Asian American people and Pacific Islanders have a higher risk of cardiogenic shock than those belonging to other ethnic groups. Symptoms. The symptoms of cardiogenic shock occurs as a reaction to the loss of oxygen-rich blood in the body. The symptoms that a person experiences may depend on how quickly the blood pressure drops and how low it gets. Some individuals may experience mild symptoms at first, whereas others may have no symptoms and then immediately lose consciousness. Possible signs and symptoms include a sudden drop in blood pressure, slow heart rate, bulging veins in the neck, swollen feet, pale blue way to the skin, cold hands and feet, sweaty skin, confusion, loss of consciousness, rapid breathing. If a person does not receive treatment, cardiogenic shock can cause life-threatening complications such as organ damage and complete organ failure. It can also be fatal in some cases. Treatment. Cardiogenic shock is a medical emergency and requires immediate treatment. The aim of treatment is to restore blood flow to the brain and other organs as quickly as possible to protect them from damage. Treatments may include heart procedures or other surgeries, depending on the person's condition when treatment begins. Treatments may include intravenous fluids, heart catheterization for coronary angiography, oxygen supplementation, mechanical ventilation, mechanical circulatory support or MCS devices, medicines to contract blood vessels and raise blood pressure. Other treatments may need to focus on preventing or treating damage to other organs. For example, research suggests that acute kidney injury occurs in 13 to 28% of people with cardiogenic shock. These individuals may need additional treatments such as dialysis or fluid replacement. Even with modern advances, treatment is still challenging. Prevention. There are no guaranteed screening tests for cardiogenic shock. As the leading cause of cardiogenic shock is a heart attack, anyone experiencing the signs of a heart attack should seek emergency medical care immediately. Additionally, lowering the risk of heart attack and heart disease may help reduce the likelihood of cardiogenic shock. The National Heart, Lung and Blood Institute recommends steps that people can take to make their lifestyle more heart healthy and reduce their risk of heart disease. This include quitting smoking if a smoker, or avoiding second-hand smoke, limiting alcohol intake, reaching or maintaining a moderate weight, maintaining healthy blood pressure and cholesterol levels, finding ways to manage stress such as mindfulness, meditation or deep breathing, getting regular physical exercise, getting 7 to 9 hours of sleep each night, limiting certain foods such as those high in sodium, saturated fats and sugars. There is no guarantee that these factors will prevent every case of cardiogenic shock. Other issues such as injury or complications from surgery may lead to the issue. However, controlling dietary and lifestyle factors that affect the heart may reduce the risk as much as possible.